Hello, class. My name is Lakita Masters. To answer the question as to why social work advocacy is so important, I would say advocacy is very important for the clients that we serve because sometimes they face barriers and they're not able to access the resources or services or even legal help that they may need in order to be able to care for themselves. So I feel that advocacy is a very important part. I've seen firsthand how advocacy can play an important part in a client's well-being. I currently work at Bay Area Community Services, and I also did the first half of my practicum there. And in that particular program that I'm working in, we help clients obtain SSI benefits. So we work with their legal advocate, we work with their medical providers, mental health providers, as well as provide mental health support if they don't have any set up already to help them obtain their SSI benefits. And I have seen, me personally, by me being so heavily involved with the client and heavily involved with their legal advocate and making sure that the legal advocate knows what they have going on with them, as far as mental health and physical health, can play a very important part in them obtaining their benefits and make sure they're engaged in services and receiving primary care help. For example, I had a client who was in the midst of obtaining SSI benefits, and a few months ago he had got attacked by just a random person, and he now has a TBI, which now changes the impact of his SSI because now it's even more of a imperative reason for him to get SSI benefits. So I had to advocate that to his legal advocate that his situation has now changed and his mental health status has also changed due to him now having a TBI. So by doing that, the legal advocate was able to update the claim and stuff like that, and it helped the client a lot, which I'm hoping that they get SSI benefits soon. I've also seen how advocacy can benefit clients in the court system as well. The job I had previous to the one I have now dealt a lot with clients that had criminal justice involvement, and it would involve me being their social worker, going with them to their court cases and talking to the judge about the services they're receiving for their mental health, primary care services they're receiving, and just the strides that they have been making while receiving mental health care. I've also seen the benefits of advocacy when it comes to helping them even get into divergent behavioral health court, because a lot of times they were in criminal court and the judge or their lawyers had no idea they had mental health stuff going on. So by me being there advocating on their behalf, it helped them get switched from criminal court to behavioral health diversion court, and it had a better outcome for the client long term. So yeah, I would just say advocacy is just a very, very important part to what we do in making sure that our clients obtain the services and resources that they desperately need. Thanks.